Earlier this week, Governor Mary Fallin called for $16 million in additional funding for mental health services in Oklahoma. Tonight, 2 News anchor Russ McCaskey talks to a mental health expert to see how that money would be spent. That's in tonight's To the Point.
We're with Mike Brose, Mental Health Association in Tulsa. Thanks for being with us today.
Absolutely. Glad to be here.
Let's talk a little bit about what's going on with mental health, because it's getting a lot of attention in the media. The governor's talking about expanding money for mental health and so forth. That's all very, very positive. You got to be pretty excited about the way things are going this year.
Well, I think that's a very important step the governor just has taken to recommend an additional allocation of $16 million, and I think it's something that we desperately need. Now, in the large scheme of things, it's not that much, but it's a step in the right direction. It definitely will help.
All right, let's talk for a moment about some of the issues that you guys have. And I know that one of the places that you like to focus on is the kids who are coming out of foster care. They've reached adult age, and they're going through a lot of difficult times at that point in their life.
Yeah, I think that a lot of people in the state don't recognize that these young adults, because they've turned 18, but yet they're still kids. They've been raised, many of them, in the foster care system. They've, as they like to say, the term is aged out of the foster care system. And while there are some services available to them, and the Department of Human Services is trying to do a better job, by and large, these kids are really trying to make the transition to adulthood in the absence of high quality care and assistance that we would give our kids after they turn 18. And these kids are not, these young adults are not getting those services, and we've got to do a better job because they're becoming incarcerated, pregnant, or homeless at extremely high rates. We got to do a better job of that.
Just kind of putting them back out on the street.
Yes, we've got to really, because they don't have families. Most of them do not have families to return to. We're trying to really promote that we address that as a state.
Yeah, and over the years, I remember, covering the state legislature back in the early 90s, almost every year it seemed like they would cut mental health a little bit. So at least it's going in the right direction.
Oh, I think everyone is beginning now to, on both parties, across the board, people are recognizing that mental health is something that affects all of us and our families, and to ignore it doesn't make it go away. To not provide the service doesn't make the need go away. We also know that if people will actually get the treatment they need, they're able to be much more productive and much more capable of being contributing members to the community.
And if they aren't, conversely, a lot of times they end up in trouble, they end up in jail, and then the state taxpayer is paying for them just in a different way.
Absolutely, you've got it exactly right.
Yeah. So when you look at this thing, and it's good that there's some money this year that's being allocated, and it's really good that people across the board, even in the state and in Washington, D.C., are thinking about mental health, but it can't be a flavor of the month kind of thing. These are generally long-term issues, long-term problems that take a long time to solve. And so you guys are going to need help for years, I would think.
Yeah, and it's interesting because one of the things, one of my mantras is that we have really high quality mental health care services here in Oklahoma. What we don't have are enough of them, that people are still going untreated, what have you. And again, as I said earlier, it doesn't make that need go away. All it does is either ignores it or defers it, or we go out another way. The percentage of people who go into their primary care doctor who actually go in with some kind of an emotional or mental health need, I've seen those statistics, some of them show, like as many as 60% of people go to their primary health care doctor really going in for some sort of a mental health or an emotional issue.
Yeah, that's interesting. So specifically this year with a little extra money, what do you do with that?
Well, I think the plans, or what's been recommended is, of course, we need additional services, but we need these crisis beds, particularly in the Tulsa metro area. This is very important because what's happening, Russ, is that people are actually who need these beds right now, who are in a crisis situation, they're not being able to be treated, many of them here in Tulsa, they're being transported in the back seat of police cars. Now, they didn't commit a crime, they're just ill. They're being transported back to police cars all the way across the state for their treatment. These crisis beds are designed to help mitigate that.
Right, and so this will help make a difference along those lines.
This will help make a difference.
All right, well, thanks for joining us, and hopefully things are kind of moving in the right direction for mental health. I know it's something that you've needed and said that you've needed for a long time.
We appreciate your interest in the topic.
All right, thanks, Mike.
You bet.